Welcome back. Today I'm going to talk about chronic pain. What is chronic pain? Chronic pain is a painful condition that lasts beyond the expected time of recovery. By different definitions, if a pain condition lasts beyond 3 to 6 months, we can consider it chronic. We classify chronic pain into different portions of chronic cancer-related pain and chronic non-cancer pain. My specialty and area of practice is chronic non-cancer pain. There are so many different reasons that can lead into painful conditions, and if these painful conditions do not heal appropriately or over the expected period of time, they turn into chronic. There are so many different changes that happen in our body that turns acute pain into chronic pain. Chronic pain is very common. It's probably the most common reason people come to the primary care clinics. Chronic pain happens when the signals come from a painful area and go to the brain on a normal acute type of pain. But over time, the body keeps receiving those signals and brain keeps perceiving that pain. And the pathways of pain turn into highways of transmission of the pain. When we have an injury to our hand, for example, the signals come from the hand, go to the spinal cord, and then go through ascending pathways that go up to our brain. And then our brain perceives the pain. So there are different gates and different stations that the pain passes through. Now, if those gates are closed, the pain signal cannot get to the brain. If those gates are open, then the pain signals is facilitated to go to the brain. So that's the change that happens from acute pain to chronic pain, that there is this facilitation that happens for transmission of more and more pain signals into the brain, and pain is perceived by the brain. I call pain humans' unseen enemy. If you break a limb, if you start bleeding, people see the broken bone and you're bleeding and start sympathizing with you. But if you have chronic pain, nobody sees your pain. For myself, I'm a chronic pain sufferer because of injury, and I have lived with chronic pain for many years. So I understand the nuances of having the pain all the time and trying to put up a brave face and have a normal life and be successful in everything that you try to do. It's very taxing on your energy and on your mind. And that's why it becomes so personal and emotional experience. Even the pathways of the pain, they pass through parts of the brain stem and midbrain that are also related to our emotional and psychological situations. So this chronic pain can affect us at the deepest emotional level. The effects of the chronic pain on every angle of the person's life are prominent. It affects all the activities of daily life. It reduces the energy. It impacts the sleep, and by impacting the sleep, the following day's activities are impaired. It affects a person's ability to create successful financial situation for their life. It affects personal relationships. It affects ability to work. It affects your ability to be active in society. All of the recreational activities will be undermined by chronic pain. So you see, there are so many different angles of a person's life that is affected by chronic pain. So if we treat chronic pain and we only think about this pain as a symptom, we are really missing the boat. We have to think about the whole person and consider how the pain is affecting the whole person's life. All different aspects of the person's life need to be looked at in order to treat the chronic pain. That's why the notion of multidisciplinary treatment becomes very important. We cannot only say, okay, there is this distribution of the pain, so there is this nerve, and we block this nerve, or there is only this psychological reason, so we give this antidepressant, or there is only this surgical condition that we do a surgery and then the chronic pain will go away. There are many cases that you go to a surgeon and the surgeon says, yes, I can treat your disc prolapse surgically, but I cannot guarantee that the pain, the chronic pain will go. So that's the reason. It's much more complicated than only doing one injection or one medication or one psychological treatment or one surgery. It is a combination of different treatment that's necessary, and the medical evidence shows that in reality, multidisciplinary treatment is the way to go for treatment of chronic pain. But the problem is, many of our patients do not have proper access to multidisciplinary pain management. Most of these treatments are not insured services. Like many of our patients may not have enough money to pay for psychological treatments or nutritionists or exercise therapists and so on, different services. And there are only a small portion of the treatments that in Canada are covered by provincial insurances and all around the world by certain type of insurances that people may have. But even the most comprehensive insurances do not encompass all the spectrum of the needs that patient has. So that's when patient self-management education comes to the play, and it becomes very important. It's very important for people to learn how to manage their conditions, to learn about proper nutrition, to learn about exercise, to learn about how they can handle and take a control of their mind, state of mind, and become the master of their mind so they become the master of their lives. These are the things that we talk about in MyPain.ca, and we go forward in future videos, try to talk about different subjects one by one and talk about patient self-management in our common journey to recovery. Thank you.